What does first-degree frostbite look like? Have you ever wondered what first-degree frostbite looks like? Understanding this early stage of frostbite is essential for anyone spending time in cold weather. First-degree frostbite is often called frostnip, and it is the mildest form of frostbite. This condition occurs when the skin starts to freeze, but thankfully, it does not cause permanent damage to the tissue. Visually, first-degree frostbite can be identified by skin that appears pale or off-white. Sometimes, you may also see slight redness or patchy discoloration. If you touch the affected area, you will notice that the skin feels cold and hard. You might even experience a prickly or tingling sensation as tiny ice crystals form in the skin. In terms of symptoms, the area affected by first-degree frostbite often feels numb. You may also notice a pins and needles sensation. Initially, there might be some pain or a burning feeling, but this usually fades as the frostbite progresses. The skin remains soft enough to recover fully if you take the right steps to warm it up and care for it properly. At this stage, there are no blisters or deep tissue damage. Recognizing first-degree frostbite is vital for survival in cold weather. It serves as an early warning sign to take action and prevent the condition from worsening. Key indicators to look for include changes in skin color to pale or off-white, tingling or prickling sensations, and numbness in the exposed skin. The affected area will feel cold and may harden slightly, but it should not feel waxy or stiff. Pain or burning sensations may lessen over time, which is another sign of this stage. If you notice first-degree frostbite, there are practical steps you can take. First, seek shelter from the cold. Gently warm the affected area using your body heat, like placing your hands in your armpits. Avoid rubbing or massaging the skin, as this can cause more damage. It is also important to remove tight items, such as rings or watches, to prevent constriction since swelling may occur. If you have access to warm water, rewarming should be done gradually using warm, not hot, water to avoid burns. First-degree frostbite often affects exposed extremities, including fingers, toes, ears, nose, and cheeks. This is especially true in freezing, windy, or wet conditions. Early recognition and prompt warming are essential survival skills that can help you avoid more severe frostbite stages, which can lead to permanent tissue injury and may requiring medical intervention. To sum it up, first-degree frostbite looks like pale or off-white skin with tingling and numbness. The skin will feel cold and hard but will not have blisters or permanent damage. Immediate warming and protection from further cold exposure are the best responses to this stage.